I'm Chaplain Rich Robinson with the Coastal Crisis Chaplaincy, and I'm also a community representative on the CJCC. And just to thank each of you for being here, because the why of why you're here is extremely important. As a chaplain, we interact with people in the places where their sacred worth and dignity are impacted with loss and tragedy. And like the folks here at this panel, they deal with people in those kinds of situations. What's amazing about what's happening here is all of you have come together for that same why. But what's really greater is that we're all collaboratively figuring out the how. Finding a criminal justice system that doesn't force society to fit into the system like a square peg in a round hole that breaks off the marginalized, but that shapes it to our society. And that's why we're here. And I have no greater pleasure than to introduce our next panel, and Dr. Chandra Brown, she's the director of the Charleston Center, and we have Debbie Blaylock, who's the director of Charleston Dorchester Mental Health, and also Jeff Youngman, who's the director of 180 Place Legal Services. So with that, I'm going to hand it over to Dr. Brown for moderating.
All right, good afternoon, and I'm going to do a good job on moderating this group and keeping them in time constraints. So if I say Elmo, that means for them enough already, let's move on. So if I Elmo them, just laugh with me with it. So we're going to do a different format where we're going to actually sit down and be more conversational. I'm going to ask a couple of questions of our panelists, and I'll share what we do at the Charleston Center. But before I do that, I want to kind of set the stage of how our conversation is going to go. So we're all part of the Charleston County Criminal Justice Coordinating Council, and when we were applying for the initial grant with the Safety Justice Challenge, we did a lot of data collecting, and through that data collecting, we saw that through our detention center, we had a lot of familiar faces and a lot of people that were at risk of being familiar faces of cycling through the detention center over and over and over. And so we wanted to get to what were the root causes of why people kept on coming through our detention center over and over. And so we did focus groups with law enforcement, and we did focus groups with people that were in our detention centers. We actually talked to people that were being detained. And some of the root causes that were identified were, of course, substance use disorders, mental illness, and issues related to homelessness. So what we're going to share is our perspectives on our work that we do with this population, and I'm going to have two really easy slides. So the first one is looking at all of the different points that when they come into the criminal justice system, the various points that they may enter in at. And so there's law enforcement emergency services, post-arrest, post-initial hearing, re-entry from jails and state prisons, and back into community corrections and community supports. And our goal up here with our panel is to stay at the very top, above law enforcement, at the top of the funnel, before people even come through the funnel. And so that's going to kind of be the basis of our conversation that we have up here. So with that, I'll talk really briefly about the Charleston Center, and then I'll sit down and join my panelists. So Charleston Center is Charleston County's Department of Alcohol and Other Drug Abuse Services, and we provide full continuum of services from detox services, inpatient services, outpatient services. We have a number of programs that work with criminal justice services that I'll talk about in a moment. We provide prevention in the community, and we also provide a lot of medication-assisted treatment. We do a lot of education at health fairs and with individuals who may have gotten involved with the criminal justice system. We have programs in our detention center. We have 6 counselors embedded in the detention center. We do adult drug court, juvenile drug court, pretrial intervention. We've been in this community for years and years and years, and we're often one of the last stops that people come to in order to get their lives together when they've hit what some people may call rock bottom. And we work really closely with a number of our community providers to make sure that there isn't barriers in access to care. And with that, I'm going to ask our panelists. Yes? So the slide is from Policy Research Institute or Associates, and so what it is it's a funnel that shows that someone, when they come in at the very top, they're all different points of where people may interact with the criminal justice system. So at the top level, the lighter, the purple, I guess that's up at the very top, is the community. And then If they get arrested, then they go to the first point, which is with law enforcement and down through the funnel. Our goal is always to not have them go into the funnel. So with that, Jeff, tell me quickly about your services.
I'm with 180 Place, formerly Crisis Ministries. People may still know it as that. I think we changed our name 3 years ago. 180 Place provides a variety of services for people that are homeless. And let me make a point that I make on my little sheet there. We don't work with homeless people. There's no such thing as homeless people. Homelessness is not a trait that any of the individuals we work with have. It's their condition they're in at that moment. It's like saying, you know, I'm a tall, curly-headed guy with a mustache. Those are my traits. But those traits for the people we work with isn't homelessness. It's just where they're at this time in their lives, and it's our job to get them out of that position and into housing again. 180 Place provides a variety of services. We do house 160 people each night, but we provide much more than just housing and food. We have case management services. Every individual has a case manager that helps them come up with a plan to end their homelessness. We have health services. We have a full-time nurse on staff. We have a couple nurse practitioners help out. MUSC comes in every Wednesday evening to provide, their residents come in to provide services for our guests. We're now associated with Fetter Family, or it's Fetter Healthcare Network now, I think is their new name. We're associated with them. They have folks on staff with us now who come in with our staff to provide physical services. We provide mental health services in conjunction with, or in partnership with the Charleston Dorchester Mental Health Center. Their RV comes to us twice a week to provide some mental health services. Plus we have a psychiatric nurse case manager on staff with us that provides mental health services. We have job placement services, we have education services, but most importantly, we have legal services, because that's why I'm here. 10 years ago, we started what was then the Homeless Justice Project. We've now morphed our name into the 180 Place Legal Services. But it's the same thing we did then, we do now. We provide free civil legal services to anybody who's homeless in Charleston. It's a holistic approach, just like Ashley was pointing out. We provide not just deal with just their legal services, but we deal with any problems they have that's preventing them from being homeless. Because if we help them with their legal issue and they still have other issues like mental health issues or substance abuse issues or unemployment issues, they're still going to be homeless. Our legal issue is not going to stop them from being homeless, but there's a lot of other things we can do and we do. We are, to my knowledge, and I speak around the country a lot, we are the only shelter in the United States that has 2 lawyers on staff full-time to provide legal services to people that are homeless. There's no one else in the country does that, as far as I know. That's enough.
All right,
Is there
thank you.
some time?
Yes, and I'll come back to ask you further questions about that. Debbie, can you please tell us a little bit about Charleston Dorchester Mental Health Services?
Yes, so I'm a part of the South Carolina Department of Mental Health. Our state is unique in this country. There are only 2 other states like us where our Department of Mental Health is a provider of care, not a broker of care. So that is in my mind, that's a big game changer in our state because it allows us to have great continuity of care and allows us to have a lot of depth in our system. So the Charleston Dorchester Mental Health Center is one of 17 mental health centers operated by the Department of Mental Health. It's the largest of the 17 centers. We have about 270 staff this year. Last year we served 9,100 individuals across Charleston and Dorchester counties. We are in 115 schools. We cover 3 school districts, and we're in every school in our school districts. We're in the detention center. We're in D. Norton Low Country Children's Center. We, as Jeff alluded to, we have an RV that goes out to 5 different sites across the course of a week to try to reach people who can't come into care and come to the clinic to get care. We have 2 large clinics. One is west of Ashley, one is in Dorchester County. And we have a lot of other specialized programs that we're going to get into in a minute. Our motto, and one thing I want you to walk away with, is that if you have the need, we have the speed. So we want to see people the minute they call us and need to see us. There's no waiting period. So if somebody tells you, man, I couldn't get in because they couldn't see us for a week, not true. That you can walk in, you don't have to call, you don't have to have an appointment, just come in the door. The other thing is a lot of people wonder about the money side of it. While the Department of Mental Health isn't free, it does have a hardship reduction scale that goes down to $2 a service. And if you can't afford to pay the $2 to see a psychiatrist, we will work with you on that. So we do not turn anybody away for inability to pay. And then the other thing, I want you to look around your table and think about this. 1 in 5 of us will have a diagnosable mental illness over the course of our lifetime. 1 in 5.
All right, so the next question that we have that we're going to talk about is the services that our agency provides to individuals with the criminal justice system. And I want to just talk really briefly about the data that we collected through CJCC, and we looked at some of the familiar faces, and then Debbie and I looked through every single name in the list of familiar faces in the data that we got, and we were able to determine how many of those faces touched our services that we offer at the detention center or through our centers. And it was pretty significant, the percentage of those familiar faces that had mental health issues, and overwhelmingly significant the number of individuals that were part of drug and alcohol services in Charleston County and at the program at the detention center. And so it's really important that we know that a lot of our criminal justice involved individuals have mental health issues, homelessness issues, and substance use issues, and it's really important that we can provide care and services through all of those different points in that filter. So the next slide, if I can figure out how to work this. Oh, there we go. So the next slide looks at those different points in the filter, and they're called intercepts. We call them intercepts. So the first intercept is community intercept, and I don't have my glasses on. The second intercept is law enforcement, and then we have initial detention, initial court hearings, jails and courts, reentry, and community corrections. And so I'm going to just talk about Charleston Center's points along those different points, and then Jeff and Debbie will talk about their services along the different points of how we interact and support the criminal justice systems or individuals that are justice involved. So at the Charleston Center at Intercept Zero, we would hope that people would come, and we also have walk-in hours daily, and we have 24-hour helpline, that they would contact us and we can help them in the community before they even get into that funnel as we had up earlier, and that we can help them at Intercept Zero before they even get into the criminal justice system. But once they interact with law enforcement, they may get 911 call or whatever, we want to be able to help them there so before they even get further into the detention center. And for Charleston, we're getting ready to open our state's first sobering center. There's only about 20 sobering centers around the nation. I'm really excited. I had a meeting yesterday, and Baltimore, Maryland is looking at opening one too, which is very exciting. But the sobering center is a place where law enforcement, when they pick up someone for public intoxication, instead of taking them to jail, they can bring them to me to sober up safely 4 to 8 hours and be monitored, receive brief screening, intervention, referral to treatment, and either come into Debbie's crisis stabilization, up into our detox services, or in one of our inpatient programs, our outpatient services, or sometimes it's just released back into the community without having to go into the criminal justice system. And law enforcement are really excited about this because through the focus groups we did, they didn't want to take people to jail. They wanted to help them, particularly the familiar faces that they worked with repeatedly. Also, actually at Intercept Zero, another thing that we do with Debbie with mental health is we do CIT training, crisis intervention training, and she'll probably talk a little bit more about that, where we work with our training our law enforcement on how to have a better response to people that have behavioral health issues so that they don't escalate, requiring them to get arrested and brought into the jail. At Intercept 2, which is initial detention and initial court hearings, we offer pretrial intervention that you heard some of our panelists talk about earlier. We provide ADSAP services for people that get a DUI and need to go through a certified ADSAP, Alcohol Drug Safety Action Program, in order to get their license back. And we also work closely with Department of Juvenile Justice. At Intercept 3, with the courts and jails, we have a 64-bed men's unit in the detention center and a 12-bed women's unit. So we provide services in-house at the detention center. We also have specialty courts, which is juvenile drug court and adult drug court, and they've been around since the early 90s. And then at reentry, they're able to, once they are released from the detention center, they're able to come to the Charleston Center and have a number of free sessions to help them adjust and reintegrate back into the community. if there was ever an area that I could beef up more and provide more support in, that would be Intercept 4 and the reentry piece. And I'm hoping to have some peer support specialists to provide some support there, but also look forward to working with some community providers to help strengthen that area. And then finally, Intercept 5, community corrections. Of course, we work closely with probation, pardon, and parole. We work with the SMART program and youthful offenders. And we also provide service in some of our alternative schools, such as Daniel Jenkins. So, Jeff, can you tell me about some of the services that 180 Place offers for people involved in the criminal justice system?
I'll talk about our newest one that at October of last year, the South Carolina Supreme Court signed an order forming a homeless court in Charleston, South Carolina. There's about 50 homeless courts around the country. There's only 3 in the southeast, in Charleston, Columbia, and in New Orleans. A homeless court is what I call a problem-solving court. People that are homeless often commit quality of life crimes: trespassing, loitering, open container, drunk in public, shoplifting for food, things of that nature that they would not do, or likely would not do, if they were housed in their own place. Especially trespassing, loitering, things of that nature. What a homeless court does is a way to allow people to do 2 things. It allows them to work on a plan to end their homelessness, and in conjunction with that, allows them to get that charge dismissed so it's no longer on their record. So any charges, these are all municipal court charges we'll be dealing with, or we do deal with at the homeless court. But any charge on your record sometimes can impact your ability to get employment, can impact your ability to get housing. It impacts a lot of things. So if we can get those charges dismissed for people, that's one less snag or one less hurdle they have to jump over. How this works is that people are referred to the 180 Place Legal Services. They come to see us. We fill out an application for them for homeless court. We do the information, pass it on to the city solicitor, who looks at it, approves them for homeless court, and then that person is assigned a public defender. And at the same time, they're assigned a case manager, not just with 180 Place. Any service provider can provide the services to individual that wants to be in homeless court. Charleston Center, Mental Health Center, anybody can do that. All they have to do is work on a plan to end their homelessness. And if they do that and they're successful doing that, then they'll get brought back into court, and their charges heard before the judge, and then it's usually dismissed. The interesting point is that the court is not held in the courthouse. The court is held at 180 Place. The judge and his staff come to 180 Place. It's a way for not only the person who's the defendant to feel more at ease because he's not in the courtroom, or he or she's not in the courtroom, but it also gives us the opportunity to let other people that are staying at 180 Place or people in the community come see homeless court in action, to see that it works, to see that if that person later gets cited for a charge while they're homeless, they can come to us and we can do the same thing with them. I can tell you that thus far, although we got the order signed in October, we didn't start court till March. Since March of this year, I don't remember how many went through court, but we've not had anybody come back to court, and no other charges for those people that their charges were dismissed. Every one of them is in housing at some place. One actually moved back to New Zealand. That's our international law case. But everybody has done well so far, and the best part about it is every time we've held court and the city solicitor gets up and says what the person's done, the public defender says what they've done, usually the case manager will say what the person's done to accomplish what they've had to accomplish. Then the judge calls them up to the table, not the bench because we don't have a dais in 180 Place, but calls them up, shakes their hand, and tells them good job, and then everybody applauds. And you don't see that in a regular court. There's not a lot of applause in a regular court. So it has worked thus far. It's worked around the country. And it's a way for us to stop what we heard in the last presentation, people being put into incarcerated for things that they don't need to be incarcerated for. So.
Thank you, Jeff. Debbie, 5 minutes.
Okay, y'all hold on, because I'm going to speak really fast. I got a lot to tell you about. So we know that folks who are suffering from mental illness aren't going to come necessarily beating down our door saying, please, please, please help me. Sometimes we have that, sometimes we don't. More often than not, we do not. So we have the only 24/7 mobile crisis team in the state. It's been around since 1987. It functions as a psychiatric EMS. It goes out into the community. Anybody can call it, and it responds to people who are in psychiatric crisis and helps the people figure out where they need to go to be safe and be healthy. We have clinicians embedded in, I call them the 4 big law enforcement agencies. We have one in CPD, one in North Charleston PD, one in Mount Pleasant PD, and one in Charleston County Sheriff's Office. That's a really big deal. This clinician belongs to the department where she is embedded, and they can use her any way they want to use her. If they want to take her out on scenes, they can do that. It's great. We have the first mental health court in the state of South Carolina. It was started in 2003. Very, very effective. We do it in conjunction with a lot of agencies. Probate court operates it. Fabulous. We have ACT teams. What is an ACT team? They are teams that are very assertive case management teams that go out into the community, seek people where they are, go to their homes every day if need be to make sure they have their medicine and make sure they're getting the treatment they need. We have a team that we just began with a lot of other agencies in the room called the Pharmacy. It was Greg Mullen's brainchild. It is a team that's basically a street medicine team that goes out into a high health disparity, high violent crime rate neighborhood, and it just engages the community to let the community know who's available to provide services and how they can get those services. We bring fruits and vegetables out to that community as the carrot, if you will, to get them to engage with us. We started in August, amazingly successful. I could tell you some really heart-wrenching, great stories, but I won't because she'll beat me because I have to hurry. We also have a crisis stabilization unit that functions as a triage opportunity for law enforcement. So you heard earlier when Assistant Sheriff Lucas said officers just want an option to incarceration. Crisis stabilization gives them that option. It's a 10-bed unit housed in Charleston Center, funded by MUSC, Roper St. Francis, Criminal Justice Coordinating Council, DMH.
In the sheriff's office.
The sheriff's office gives us a deputy and all the food for the unit, 3 meals a day for 10 folks. And officers can drop people off at this unit that they pick up. If they want to divert them from jail appropriately, they can. We're not talking about violent folks. We're talking about low-level offenses, and they can get the treatment they need rather than getting thrown into the system and becoming incarcerated. They can also call the unit and say, hey, I just picked up Debbie. She's homeless. What can I do with her? And then I can call Jeff and say, Jeff, take her. And Jeff will take her. And it's great for everybody. Breathe. Oh, okay, I'm done. Hell no, I'm done.
All right, so the last one-sentence statement that I would like us all to make before we power up a brief 8-minute video for our last bit of our panel is a barrier and an ask. And I know that all of us have the same too. It's access and stigma. And so if you guys can just share briefly a sentence on access and stigma as barriers and what we would ask for our community to support the work that we do.
Me?
Yes, Jeff.
The one barrier we have to the homeless court that's been surprising to me is that the municipal court, the judges, Judge Mendelson, Judge Rico Flores, has been great referring folks to us. Charleston Police Department recommends people to be in the homeless court when they bring defendants to the court, but we have not gotten the buy-in or the help from the service providers in the community. We've had 2 events where we've asked people to come and talk about the homeless court and how they can send their folks to us if they're homeless and if they have been cited with a criminal charge, and we can still do that. So that's the one barrier I have.
And the stigma, I know that you...
Stigma, the one that I mentioned at the beginning, that people that do not have homes, they're human beings, and they're not homeless people. And I think just remember that, that's fine.
Thank you. Debbie?
So we can have the best services in the entire universe, but if people are afraid to access those services because they're afraid they'll be made fun of, they'll be afraid that they'll lose their job, they're not going to come to services. So my ask of you is to stop making fun of people with mental illness and help them get treatment. Treat mental illness like any other illness in the universe. The head is a part of the body. It is not different from any other illness. Please treat it as an illness.
And I think that I would echo the same statements that Jeff and Debbie said. From the addiction standpoint, addiction is a disease of the brain. It was classified as a medical disease back in 1956, but we still treat it criminally and as a moral issue. And I would ask that you would stand with me to recognize that it is a medical disease, that people should be supported in taking medications for medication-assisted treatment for someone with an addiction disease, and that you don't treat them like a criminal, or that you make them feel shamed and guilty for having the disease. So with that, I think we have a brief video that will show, that will highlight some of the services that we work collaboratively with mental health and our EMS services, and looking at how we can better serve the community so they're not going to the detention center.